Last week, Republicans passed and Donald Trump signed into law the biggest cuts to healthcare in United States history. Unacceptable. I published a list of 338 rural hospitals across the United States that these cuts put at risk of closing or cutting off services. With these huge cuts put in place, rural hospitals across the country now are sorting through the difficult questions. Will they have to lay off staff? Will they need to stop providing labor and delivery care or mental health care? Will they need to close their doors entirely? One hospital in Nebraska already announced it would close because of these cuts. That's a preview of coming atrocities. People will be forced to travel further for chemo. They will miss their annual appointments. They will be at risk of losing a loved one to a heart attack or stroke or overdose because EMTs had to travel further. This is dangerous, devastating, and even deadly for communities who rely on these hospitals. Republicans have talked about a rural hospital fund. It's more like their Medicaid cuts bailout fund, and it's not going to do enough. It won't fill the funding gap, and the fund expires because meanwhile, the healthcare cuts are permanent if Congress doesn't reverse them. We must keep fighting to protect healthcare. The Republicans have now prescribed an aspirin for a very serious disease, which they have injected not just into the rural health system, but all of the health system of our country. We have to stop it. We have to reverse it.